Dr. Jackie Gray is from the Carents Room. It's a website that's full of information for looking after elderly parents. Jackie told me how families feel when the decision's been made to put a loved one into a care home.
Families find this very difficult. It's a huge decision and it's not something that we do every day. Many of people in this situation won't ever have done it before, won't have had anything to do with the care system before, and they won't know where to start, what to look for, what to do and what's entailed. So it's a huge process, very daunting, very emotional and practically very challenging too.
Where do you start then?
Well, I would recommend you start locally with advice if possible. So if somebody's coming out of hospital, I think there will be staff that can advise you. But if you're starting at home in the community, my first port of call would always be in England, the Care Quality Commission, the CQC. There's a website, cqc.org.uk. And the Care Quality Commission is the national regulator that runs a register of every care home in the country. And it is responsible for registering them and maintaining the register. And on their website, they will have a list of all the care homes and you can search by location and also it will tell you the nature of the care that's provided in that home as well. So it's a great place to get a shortlist from where to start. And then you need to know, I suppose, whittle that down to something that suits you and your family and the person that's going to be cared for.
What about going to take a look? Do you need to book an appointment or can you just turn up to see what it's really like?
I would definitely advise that you visit. I would visit many just to get a feel for what is available, what the scope is, and that means that you've got a sort of benchmark to compare with. So even if you're interested in just one, it's worth visiting another one. Secondly, they do prefer that you make an appointment. However, it is something sometimes I think helpful just to turn up. You won't be popular if you turn up at meal times, just like you were going to somebody else's house. If you came at dinner or breakfast, you wouldn't be very popular. But a lot of the care home providers that feel passionate about the care they're providing will say that they want to be transparent. They want people to be able to call in at any time, just as you would when you were visiting somebody in their own home. So if somebody says, oh no, you'll need to make an appointment, that might make you think, oh, I wonder why. What is it about the appointment system that's necessary?
And how much planning should we do before visiting a care home? It strikes me that we're looking for somewhere for a loved one to live. If we were looking to buy a house, we'd have checklists as long as your arm, wouldn't we?
Yeah, absolutely. And I think you need the same level of checklist for this situation too, because I think just like if you were buying a house, it's not easy to just walk away if it doesn't suit you. It's not easy to walk away from a care home if you're not happy there. It can be very, very difficult once the loved one's settled in. So you do need to have that checklist. And firstly, you need to know what they need. So what do they need in terms of care? Do they have a special condition like dementia? Will they need future nursing care? Is their condition progressing rapidly? So there's something about their care needs that you will need to understand, because somebody who is very mobile and independent is in a very different category to somebody who perhaps is very confused and needs help with every single daily task, like going to the toilet, getting dressed, etc. So there's something about their needs and being clear about what they need and what's provided in each of the homes, not just now, but maybe down the line in a few months' time, in a year's time, that sort of thing. Then there's something about what they actually want. You know, are you looking for something close to your home? Are you looking for something close to where they used to live, to their friends, other members of the family? So there are issues about location. What would suit a nice friendly care home or a more hotel feel? So there's things about like that. You might also want to look at the local medical services, because somebody in a care home might rely on their GP quite a lot. And obviously GP services vary. So you might want to consider the standard of the GP services in the area and what else is available if you wanted to go for a walk outside the care home. Look at any reports about the quality of care that's being offered. Those reports are available on that CQC website, which will grade the standard of care as outstanding, good, needs improvement, or inadequate. So that's something to bear in mind, but also the date of that report, because it might be out of date and things might have got better, or they might have got worse too. So something to bear in mind there. And also the staff. I think you want to look at a home that has good staffing arrangements, plenty of staff, and not a high turnover of staff, so that you can be reassured that the person that you really care about is going to be cared for by a continuing caring care workers.
So maybe then a good question, if you're there talking to the staff, is just to, really informally, how long have you worked here?
Absolutely. That's a great question, because turnover can be a sign of poor management. And then it does hinge on affordability, unfortunately, as well, because these care homes can cost if you're not getting paid by the state. And the costs can vary considerably. A ballpark figure would be around about 1,000, but that's quite cheap, probably £1,000 a week. You're looking £50,000 a year there. So do consider the financial element, what is affordable, what you would like, and then what is available as well, because I've said you should visit more than one to get a sense, but having your heart set on one home which doesn't have any availability is a problem too. But also bear in mind that beds do come up on an ongoing basis. So don't be put off if your chosen home doesn't have any availability immediately. And finally, on that point, I would say, if possible, and if timescales and health matters allow, and if the home allows as well, it might be a good idea to do a little trial, maybe a weekend of respite care or a week of respite care, to get a sense of whether that home really is appropriate. So that's something to bear in mind as well.
Can you just get a feeling that a care home's right?
Well, I think it is. You said before, this is like choosing a home, and anyone who's looked for a home, buying a home, there is that feeling of, oh, this one feels right. And I think that's priceless, really. If it feels right for everybody concerned, that's a huge step forward.
Dr. Jackie Gray from the Carents Room. You can find her website just by searching Carents, as in parents, but with the C at the beginning, Room. Tomorrow, Lee Calvert is Director of Adult Social Care at Stoke-on-Trent City Council. And Lee will tell us the process of social care, how the council can support care at home, and at what point maybe a care home is needed.